in terms of the collaboration for the Joint Clinical Research Office, we're a 3-year funded pilot project that's funded by Brighton and Sussex Medical School. We have 4 partner organisations that we work across. These are the University of Sussex, the University of Brighton, Sussex Partnership NHS Foundation Trust, and Brighton and Sussex University Hospital Trust. And the idea was that all 4 partner organisations desperately want to do more clinical research and to do more and bigger clinical research projects. So we're here as a central office to support clinicians and academics across those 4 partner organisations to support the research management process and make sure all grant applications are submitted as high quality and as best as they can be.
Well, a really big challenge is that nearly all clinical research has been stopped. So NIHR stopped everything that was everything that was not COVID related or absolutely required for the care of patients. So that meant that a lot of work was completely disrupted. And at the same time, funders have repurposed both existing funding they've already given out, but also monies that they are looking to give out at the moment towards COVID, the short term, the long term, and the very long term needs that people will have as COVID worsens so many health and other inequalities in our society. For example, the NIHR ARC put out a funding call, which many people from BSMS and Sussex and Brighton applied for small scale, highly responsive, fast response projects that were entirely appropriate for the early phase of the COVID epidemic.
The NIHR ARC that's come down to Kent Surrey and Sussex is a 5-year infrastructure award, and it comes with it comes 8 research themes into the local area and some unallocated research funding, which opens up opportunities for all local researchers across Kent Surrey and Sussex to do small projects, which will hopefully move on to larger funded grant awards. The plan was always to do 2 or 3 rounds of this unallocated funding, but because of COVID, the awards were allocated just for COVID research specifically, and it was a very rapid response call, showing that the ARC could quickly respond to the emerging crisis. And so we were able to put in lots of COVID-related projects that are really going to make a difference directly to services across the NHS.
So I have some research funding from the ARC, which has been supplemented by money from the Clinical Research Network, and there may be another source too. And what we're really interested in looking at is building on my work on care homes and people living in the community in poor health. We're looking to see what are the issues for care workers in care homes, for hospital staff, for residents and their families, and also we hope in domiciliary care. What are the issues about moving from place to place, both the operational issues about COVID testing, but also the kind of wider issues about fear, not being able to move around, all the issues that are tumbling out of COVID, and how we can help services, both keeping people at home in their care home and also returning them. So we can make that work better for everybody concerned at a time of real fear and anxiety, very justifiably.
So the JCRO is very much about expanding on the collaborations across the partners. So within our 4 partner organisations specifically, but then beyond that as well. And the NIHR ARC KSS is very much about expanding our horizons beyond our initial organisations and out into the region to really take advantage of all the expertise there is across Kent, Surrey and Sussex. We were very excited to be involved in the COVID call for ARC. The JCRO supported 12 applications across our 4 partner organisations, and across the whole of Kent, Surrey and Sussex they received 33 applications. They funded 6, and 5 of them were from Brighton and Sussex. So we feel really thrilled with that result, because it means that the Brighton and Sussex researchers are really contributing to the COVID response for these ARC calls.
I think it's really important that health researchers can respond to what's happening. And one of the criticisms of health research is that we always want to do a randomised controlled trial and it takes years. And often the answers aren't quick enough for policymakers. And I think COVID presents an opportunity to really get our act together in terms of working at pace, delivering answers at pace, and delivering answers through sort of adaptive designs where actually we're responding to how the world is changing. And I think it's a real opportunity for us to step up. If we don't, we will fail to have contributed, and we have an obligation to contribute to the COVID response. But we'll also be upping our game in terms of future responsiveness and ability to respond better. So I think it's a really important challenge that we all need to embrace.
So there will be further opportunities. ARC KSS will open up further rounds of funding, and if you want to find out more, you can either go to their website or contact the JCRO specifically. Beyond the ARC calls, which are quite small and quite specific, if you are interested at all in getting involved in any clinical research, any applications to NIHR or other funders, then come straight to the JCRO. We have a website and we have a generic email address. Come and talk to us, and we will help you to put together your application.